Hello, I'm Wendy Damida from MD1B. Today, we will be doing the head-to-toe assessment. So, let's ask the patient for her personal information. So, Miss, anong pangalan mo at kailan ka pinanganak?
Maxine Buduan po, year 2002 po, November 23.
So, anong nararamdaman mo ngayon?
Bale, sumasakit po yung ulo ko 2 araw na. Tapos, sobrang sakit po niya, lalo na pag nasa araw.
May allergy ka ba?
Wala naman po.
May iniinom ka bang gamot?
Wala po.
So, check natin yung sa ulo mo. Pwede ka bang umupo ng maayos para ma-check ko yung ulo mo?
Sige.
Okay, thank you. So, iti-check natin yung mata mo. Mag-focus ka dito sa kamay ko. Saan yung blurred na part?
Yung background po.
Hindi ka ba nadudulin?
Hindi po.
Okay. So, ang susunod, i-check natin yung heartbeat mo. So, since walang available na stethoscope, yung sa pulse mo na lang. So, i-check muna natin yung lungs mo. So, yun nga, since wala tayong available na stethoscope, gamitin ko muna itong kamay ko. Inhale. So, i-check mo natin yung tenga mo. So, normal naman siya. At ngayon naman, i-check natin yung fingers mo. May
Nag-uway po ba siya?
Hindi naman, normal naman siya. Okay, so i-check natin yung knees mo. Hindi ba ito nanghihina?
Hindi naman po.
Hindi ba nagka-cramps minsan?
Hindi po.
Okay naman siya, normal naman. Okay, pain? Taas mo. Okay, normal naman. So, i-check naman natin ngayon sa feet mismo. So, wala namang, hindi naman namumuti. Okay lang naman siya, normal. Yung isa. Okay, good. So, ang isusunod naman natin ngayon ay sa back. So, hindi ba masakit dito sa ganito mo?
Hindi po.
Okay. Okay, good.
So first off, you always want to check your patients for symmetry. You want to make sure that they're equal on both sides. You always want to be consistent with how you do your assessments. So always start with the head or always start with listening to specific areas. You always want to remain consistent because if you start to become inconsistent, what happens is that's going to slow you down and create more frustration for yourself. The next tip that I have is to always look for the abnormal things. So you inherently know what's normal. So whenever you're doing your assessment on your patient, always look for the abnormal things. So are these abnormal lung sounds? Are they abnormal heart sounds? Are there differences in the way that a patient maybe blinks or speaks? You can always look for those abnormal things and identify those. By focusing on these abnormal areas, it allows you to focus your attention on things that may need a little bit more nursing care. Lastly, when you're doing an assessment, always be aware of what your patient needs. If they're in pain, make sure that you're not pressing on all of the painful parts. If they're complaining of an abdominal pain, always assess that area last. Doing your assessment is extremely complicated. It's very time consuming, and you need to make sure that you practice these tips and tricks to make sure that you are on your A game.